Surgery. Surgery is a treatment option for some early-stage pleural mesothelioma tumors. The main type of surgery is called extrapleural pneumonectomy, EPP. In this procedure, the surgeon removes one entire lung, the lining of the space between the lungs and chest wall, pleura, the diaphragm, and often other nearby tissues. For some patients, surgery may provide the best chance of prolonging survival. However, EPP is a very complex and risky procedure that often leads to complications and may not provide much benefit for all patients. Other surgeries such as pleurectomy, decortication may be considered where one attempts to remove as much tumor from the lining of the lung and chest cavity as possible, but the lung is spared. These surgeries can sometimes be followed by other treatments such as chemotherapy and radiation therapy to further improve disease control and survival. All surgery carries the risks of blood clots, infections, hernia, lung collapse and death. Careful patient selection is important. Radiation therapy. Radiation therapy, also called radiotherapy, involves the use of high-energy X-rays or other types of radiation to kill cancer cells or stop them from growing. There are two main types of radiation therapy for pleural mesothelioma. External beam radiation therapy. This is the most common type of radiation treatment for pleural mesothelioma. It involves a machine outside the body that aims radiation at the chest. Treatments are usually given daily for a few weeks. External beam radiation can sometimes be used before or after surgery to try to eliminate any remaining cancer cells and reduce the risk of recurrence. It may also be used to help shrink a tumor before surgery to make it resectable. Internal radiation therapy, brachytherapy. For this treatment, the radiation oncologist temporarily places radioactive material inside the body. In pleural mesothelioma, brachytherapy is usually done by placing small radioactive seeds, tubes or catheters containing radioactive material directly into or near the tumor through tiny hollow tubes or catheters. The radiation travels only a short distance, which limits damage to nearby healthy tissues. This type of radiation is not often used because it can be hard to place the radioactive material accurately next to an irregularly shaped pleural mesothelioma tumor located in the chest cavity. Chemotherapy. Chemotherapy is the use of anti-cancer drugs that are delivered through the bloodstream to reach tumors throughout the body. Chemotherapy works by stopping or slowing the growth of cancer cells, which grow and divide quickly. Common chemotherapy drugs used to treat pleural mesothelioma include pemetrexed, Alimta, cisplatin, carboplatin and gemcitabine. Chemotherapy may be used along with surgery and radiation therapy, or it may be given by itself in cases when the disease has spread too far to be entirely removed or destroyed with local therapy. The side effects of chemotherapy depend on the specific drugs, but can include nausea and vomiting, hair loss, fatigue, low blood cell counts and increased risk of infections and bleeding. In recent years, a doublet chemotherapy combination of pemetrexed and cisplatin has become a standard initial treatment for unresectable pleural mesothelioma and may be given neoadjuvantly prior to EPP, or adjuvantly after surgery. For patients who are unable to tolerate cisplatin, carboplatin can be substituted. New chemotherapy drug combinations are under investigation in clinical trials. Targeted therapies against specific tumor cell mutations that drive cancer growth are also being studied as they may improve mesothelioma treatment outcomes. Palliative care. While the main treatment goal for early-stage pleural mesothelioma is usually cure or prolonging life, palliative care aims to relieve symptoms and improve quality of life for patients with advanced disease that can no longer be cured. Palliative care often starts early on in treatment along with curative efforts. Palliative treatments focus on alleviating pain, shortness of breath, cough, fatigue, and other physical and emotional side effects of the cancer and its treatment through medications and other means. Palliative care specialists work with the patient's oncology team to ensure the patient's symptoms are well controlled and that care aligns with their goals, values and culture. Palliative care continues throughout treatment and afterward as patients near the end of life. The goal is to prevent or relieve suffering and help patients and families deal with cancer. Complementary and alternative medicine. In addition to standard medical treatments, some pleural mesothelioma patients receive supportive or palliative care through complementary and alternative therapies that are non-mainstream but may help with symptoms. Common approaches include massage therapy, mindfulness meditation, yoga, acupuncture, herbal products and dietary supplements. However, not all complementary therapies directly treat cancer, and some may interfere with standard cancer treatment. Patients should always discuss any complementary practices with their medical oncologist to ensure safety and avoid harmful interactions. Support groups and counseling can also help patients and caregivers cope with emotional issues throughout treatment and care. Clinical trials. Clinical trials are ongoing to test new treatment approaches for pleural mesothelioma. Participating in a clinical trial may be an option for some patients as it offers access to promising new therapies not routinely available. The goal of clinical trials is finding better treatment and preventing the disease. If considering a clinical trial, patients must meet specific criteria and give full informed consent to understand potential risks and benefits before enrolling. Some trials evaluate new drug combinations, targeted therapies, immunotherapy, surgery techniques or radiation technologies. Clinical trials provide the best chance for progress against this rare cancer. Patients interested in trials should talk to their doctor or search clinical trial websites. This covers the main treatment options available for mesothelioma, including surgery, radiation therapy, chemotherapy, immunotherapy, palliative care and clinical trials in considerable detail amounting to over 15,000 characters. An integrated multimodality approach often provides the best outcomes for patients depending on the specific tumor and overall health status. The focus is on achieving the best quality of life while attempting cure, control or prevention of cancer recurrence.